Hey, this is Sandy,
And Randy.
and we're here on AT Corner.
Being an athletic trainer comes with ups and downs, and we're here to showcase them all.
Join us as we share our world in sports medicine.
Welcome back to AT Corner. We have a very exciting interview for everyone today.
On a super broad topic.
Oh, very broad. We had a tough time coming up with the title for this one.
I know, it was going to be like way too long. Just to cover everything we talked about.
So today we're sharing our conversation with Alison O'Connor. She received her bachelor's in athletic training from the University of Vermont, her master's in kinesiology from the University of Connecticut. I almost said Kentucky, so I almost messed that one up. And then she completed her athletic training residency at the Stedman Clinic. She also holds credentials as an advanced EMT with the National Registry of EMTs, and she's also a certified orthopedic technologist.
And as you'll hear, she has worked in a variety of settings.
That is so true. I lost count of how many settings she was in.
But now she's actually a Division I athletic trainer at Dartmouth College.
Nice.
I think it's really special that she's back at the D1 now after completing an athletic training residency, because I feel like a lot of people after doing residency think, oh, I have to go straight into the physician setting.
Yeah, and we actually touch on it in our conversation with her, but it just shows like you can be in a different setting and then jump to another one. Like you don't have to be locked in for the rest of your life. So are we ready to hear from Alison?
Yeah, I don't think we should delay anymore.
So here's Alison. So we always have to start with cryo breakers. You know,
Okay.
we wanted a nice fancy term instead of just icebreakers. That was boring. So
I love it.
First one is what made you become an athletic trainer?
So I've been interested in sports medicine since I was a freshman in high school. My high school athletic trainer, Andy, I thought he had like the coolest job in the world. I wasn't the most talented athlete. I may or may not have been that kid who I didn't fake injuries per se, but I really prolonged stuff. I would like jump to the end of the line or like go in totally unnecessarily, not because I wanted to miss practice, but because I wanted to see what was going on in the training room. It just looked like he had a cool job. Sports medicine seemed really interesting. I wasn't sure what I wanted to do. Did I want to be an athletic trainer or a PT, maybe like a PA, or even go on to become a physician? But I knew that at least if I started with a degree in athletic training, I would be able to get a useful college degree and have a little time to figure it out. And then I really fell in love with athletic training, and I was like, yep, this is it. This is where I'm going to stay. So that's what I decided to do. Even after graduation, I kind of toyed with the idea of becoming a PA, but it was actually my husband, who is a PA, who talked me out of it, which is kind of funny. He was like, hey, whatever you want to do, like, I totally support you. I think you'd be awesome no matter what. But I've never seen anyone who really loves both their job and their career as much as you. And I could never be a part of talking you out of doing that. And I was like, okay, you're right. I'm going to stay with this. So
that is so important, especially in athletic training. We talk to everyone we talk to. We're like, you have to love it to be in this profession.
Big time.
And actually, speaking of that, our next cryo breaker is, what is your athletic training spirit animal? So for those of you who don't know what this is just a question we made up just to try to get to know, like, what is a modality, rehab tool, tape, braces, or any tool of the trade that really represents you, Alison?
I love this. I'm totally stealing this for interviews in the future.
Yes.
It's a much more appropriate spin than like, who's your favorite Disney princess or whatever. I would have to say it's PowerFlex, because it's strong but flexible. It's really utilitarian. You can use it for just about anything. So if I could be as versatile and useful as PowerFlex, I think that's a good thing.
I've never thought of that. That's pretty good.
PowerFlex is my favorite. I love it.
Yeah. Or like whatever knockoff brand.
Yeah.
No, you're the name brand.
Yeah. Oh, thanks.
And then always what we do here on AT Corner is we like to jump right into our interview questions with an experience, or what we like to say is pair evidence with experience. So if you could kick it off with a story that was something memorable to you, or something that kind of brings to light what we're going to be talking about today.
Yeah, so this is a really good question, and I'm really glad that you gave me this cheat sheet so I could think about it ahead of time, because we'd probably sit here for like 20 minutes otherwise. I actually reached out to some people to try to get an answer, because I was like, wow, this is a great question. And the best answer that I thought was from one of my former students. Her name is Leah, and she just talks a lot about how I've really stressed the importance of networking to her. And she said that I modeled it really well, but I also really encouraged that in her. And I honestly still do to this day as she kind of goes through her early growth in her career. But networking doesn't just help you meet medical professionals, but it also helps you improve your communication. Some of the things that she pointed out that I did was always making sure she introduced herself and interacted appropriately with the visiting athletic trainers or the host athletic trainer on the chances she got to travel, team physicians, strength and conditioning staff, pretty much anybody that we work closely with. I think it's really important for students to communicate because that's really how you learn to do it and learn to do it well if you've got somebody mentoring you and kind of encouraging you along, because it can be kind of scary. But she told me that was really, really important to her experience as a student and played a big role in her development and made her a lot more comfortable when she got out on her own. So she appreciated that. And I guess that's how I would maybe tie what we're going to talk about later into how I actually use it.
Nice. That's awesome. So you have, from our last conversation, you have such a diverse background in many different athletic training settings. What interested you in pursuing an athletic training residency?
Oh, so that is a very nice way to say that I bounce around a lot, which is, I appreciate that. So this is a long story, as is pretty common for me, but this goes all the way back to like third grade. So I grew up ski racing and I completely idolized Peekaboo Street. For those who don't know, she was like the chapstick girl in the late 90s. She was also a really, really good ski racer, but she had this big chapstick deal. Anyway, I basically learned everything I could about her. And I remember she absolutely just kept wrecking her knees. Mm-hmm. And she talked in her books and stuff about how this Dr. Stedman was a tremendous surgeon and he was really instrumental in getting her back. So before I even knew that sports medicine was a thing, I was like, hey, Dr. Stedman, I don't know who you are or what you do, but you saved my idol's career and you're awesome. So I grew up and actually learned what sports medicine was and kind of developed this dream to become an athletic trainer with the U.S. ski team. And I didn't really know how to go about that or any of that, but I casually mentioned it to this athletic trainer that I knew from UVM named Mike. And he said, hey, if you're interested in doing that, you should look into the Stedman Clinic Athletic Training Fellowship. And I was like, cool, what's that? So obviously got right on Google, started looking stuff up, and I realized that was not only a way to kind of get my foot in the door with this crazy dream that I had, but it would also be a really cool way to experience some really unexpected stuff. And that was pretty early on in my schooling. I think I was maybe a sophomore in college when I learned about it. I don't know. It was a while ago. But when I finished school and even through my undergrad, I was pretty sure I was I want to be a high school athletic trainer. I want to work in or near my hometown. I kind of never want to leave Vermont, and that was all great. But then a series of events happened and I got comfortable with both the idea of leaving Vermont, and then I realized that I actually really wanted to be a collegiate athletic trainer. So that pushed me into grad school and getting away from home, which is honestly really huge. And because of all that, I started looking into it and I was like, no, this is something that I can do. So I continued to learn about it. At that point, a couple other alumni from my undergrad program had gone through the athletic training residency at the Stedman Clinic. I stayed in touch with them and just came on top of it. And the more I learned about it, the more I was like, yeah, I really want to do this. And of course, at that point in my career, I was married and my husband had a career as a PA, and it was like, okay, I've gotten this far. I'd gotten in actually. And I remember sitting on the sidelines. I was finishing my GA position at UConn and I had been offered the job and I had a couple of days to think about it. And I went up to one of our team physicians. He was an orthopedic surgeon. I was like, hey, what do you think I should do? I've kind of got these job opportunities that are on the horizon, but also I've been offered, this chance to go out to Colorado and learn at the Stedman Clinic. And he just stopped what he was doing. He looked at me. He's like, oh my God, go. Why are you even asking me? So I went home and talked to my husband and he was like, yeah, sure, I'll quit my job so we can move across the country and you can do another essentially year of school. Which I like to this day, I'm like, I can't believe you did that for me. I knew I was going to learn a lot. I knew it was going to be an incredible experience, and it was beyond what I could have even prepared myself for. So that's why I did it, and hopefully a little bit about what I got out of it.
Nice. That's awesome. That's so cool.
Yeah.
Would you move across the country for me?
Absolutely.
Aw, good job.
So, speaking of the residency, when in your career did you actually pursue this? Was it right when you got out of school, or was it a little bit later?
So I have kind of done my whole career a little bit non-traditionally. I did my residency 6 years into my career, but right after grad school. I worked for 4 years before I went to grad school and did my GA position. And then I did that for 2 years, and then I did the residency. You know, for me, that was the right call. I've known I wanted to be an athletic trainer for a really long time, but as evidenced by my bouncing around, I guess you could say. I guess it's not always been totally clear exactly what I wanted to do with that. So, you know, that's when I did it. For me, that was really good. You know, the other people in my class came and did it at different points. A couple were, 3 were, they went straight from undergrad to grad school. Actually, the other 4 did. One of them did an internship in the NFL in that year in between grad school and going to residency. But I had a lot more, you know, clinical experience, but I don't think that was necessarily made me a better or, you know, worse resident. I think it just made me a little bit different. I think I got a different experience out of it, but I don't know, you know, it was a little atypical, but totally not unheard of.
And if you were to tell young athletic training student Alison about the residency, would you recommend the timeline you took, or would you recommend a different timeline about when to do the residency?
For me, yes, absolutely. Like, I needed to go through things in my life and get to that point so that I was prepared for it. So for me, it was absolutely right. But I think if you were to ask other alumni, they might say the exact same thing, even if they went through it at a different time. I think, you know, as we all grow and evolve, things kind of change in our lives, and you have to take that into account. I will say it is really hard when you're like 27 and have a spouse to like uproot and move across the country. So that's a consideration for sure, but it worked out for us.
Awesome. As you go through your athletic training residency, what are the expectations?
Ooh, they are high. So I can really only speak to my program and my experience. So my expectation is that a residency program, and I think this is the expectation kind of across the board, that a residency program really functions to enhance the baseline knowledge and skill kind of at the same rigor as an academic degree program. I didn't get a degree from my residency, but I absolutely consider it a year of my schooling. The expectations that they put on us were really high. The nuts and bolts of the program were that we were basically immersed in the clinical practice of the physicians we were rotating with. So that meant that we worked with their support staff to make sure that the clinic ran smoothly. We were doing documentation for the physicians alongside your staff. Let me tell you, when you're expected to, you know, write a note that sounds like it came from an orthopedic surgeon, that really elevates your game. Yeah. We assisted with procedures and surgeries. So from like a technical standpoint, like they were high expectations, but the academic expectations were super high too. It's a teaching environment. There's an orthopedic surgery sports medicine fellowship that runs at the same time, and you become really close with the physician fellow class that is, you know, there at the same time as you. The attendings that we worked us kind of held us to commensurate standards as they did the physician fellows. So, you know, when you're in clinic, there's going to be an X-ray or an MRI or a CT scan up, and the attending will stop and they'll look at you and they'll be like, "What do you see?" And you're not expected to say like, "Oh, there's the ACL. It looks torn to me." You could, no, that was not it. It was like, you have to identify the ligaments of Risberg and Humphrey. You can't just say that's a meniscus and it looked like a tear. They expect you to say, "Oh, that's a horizontal cleavage tear, the medial meniscus." You know, we're expected to measure alpha angles and CE angles of the hip and present those findings accurately, obviously, to the attending. You know, because if you don't do it right, you know, they're nice about it, but you better do it right the next time. you're assisting in surgery, you learn how to anticipate the surgeon's next move, which can be really hard when you're rotating with 10 different surgeons who all do things a little bit differently. And, so you have to learn things like how to change the retractor you're using as the dissection gets deeper without prompting, things like that. Sometimes they'd stop partway through a scope and they'd be like, cool, what do you see? And you're like staring at a scope, and you have to identify like the conjoint tendon and things like that. So there was really high expectations for sure. You also learn things like graft prep and skin closures, and really, that stuff is just technical. You're expected we had an amazing lab. And you could go in there anytime and practice those skills. And a lot of times we'd work with the MD fellows. They were really instrumental in teaching us how to assist and anticipate stuff. That was how you studied, was going in and doing practice surgeries with them.
That's so cool.
Yeah, it was really cool. I mean, I think in, especially as they start talking about this orthopedic specialty stuff coming out, I think, it's, from what I understand, it's really designed for those residency trained athletic trainers. And I think there's probably a bit of a misunderstanding on what some of these residencies are offering and exactly what you do learn. It really is next level. And is it necessary to be a good athletic trainer? No. But I'm really really grateful for it. The doctors, their staffs, the PAs, the other athletic trainers and nurse practitioners, they were incredibly willing and knowledgeable teachers. They're also really busy with their clinical responsibilities. So, you're expected to be engaged. Otherwise, they're not going to waste their time with you. I think there's kind of this assumption, especially as athletic trainers, and I know I felt this way when I was newer in my practice, that you're supposed to know stuff, and that admitting you don't know something or asking a question implies that you're not good. I don't know about you guys, but I've definitely been guilty of being like, I don't know what that is, but I'm going to pretend that I know what it is. And then I'm going to go home and look it up. And that's for sure not the best way to do stuff. I've learned that engaging, admitting you don't know what you're doing, or you don't know the answer, especially, like you talk to an orthopedic surgeon, they're asking you anatomy questions, like they're probably going to get to something you don't know. That's okay. Like, of course they're going to know it. They dissect and look at this stuff every day. That's not what we do. So, just kind of understanding that if they're taking the time to teach you, to engage you, you really have to give it right back and be a part of it.
And take all the initiative you can.
Oh my God, for sure. The more that you're willing to do, I almost dropped a graft once in surgery. That was so embarrassing. I remember, but the surgeon just let me keep going. He's like, bet you'll never do that again. And then we just went on with the day, and I was like shaking. I was like, oh my God, that just happened. But then once they get to know you, they start to work with you and they teach you things, and they see you learning those things and applying them. They make things a little bit harder, and you continue to raise the level of what you're doing. That's an indescribable feeling. That's kind of on par with that feeling of when you work with an athlete and they're out for a really long time and they get back and they score their first goal back, and they look back at you and they give you that big thumbs up, and it's the best feeling in the world. Well, having those surgeons kind of elevate you gets to pretty close to that feeling.
Working with so many different professionals, communication is key. So how does communication with other professionals change as you progress through your career? Because I know when I was just certified, I was terrified to sound dumb in front of physicians.
Yeah. Well, I will say that going through residency teaches you that you're going to sound dumb in front of physicians. You just get used to that. But for me, I think it's been just overall, it's a process of getting more comfortable with it. I think it's very normal for us. We finish school, you pass the BOC, you're super excited. You're like, yes, I'm finally an athletic trainer. I finally know what I'm doing. I can do this on my own. And I think probably I'm not the only one who at the end of their senior year was like, oh my gosh, just let me do it on my own. I know what I'm doing. And then you start on your own. You're like, oh my gosh, why did somebody let me do this? I have no idea what I'm doing. So I always tell the new grads, I'm like, the first day that you're out there on your own is just the beginning of a new chapter in your education and your professional evolution. As a whole, we are an often overlooked and very misunderstood profession. And because of that, my mom will be the first one to tell me that she's like, stop while you're out with a chip on your shoulder. you're good at your job. And I'm like, yeah, but like, does anybody know what my job is? So I think, it's really important to remember that you are a part of a healthcare team. We all work collaboratively. We call upon each other's strengths. And I think the more professionals in different areas that you work with, the more you realize that we are just a part of a whole. And we are all working better together to curate the best possible outcome for our patients. I think it's like kind of this running joke in athletic training. So like an athlete goes out on the field and a spectator runs out there like, I'm a doctor, how can I help? And you're like, cool, what kind of doctor are you? They're like, I'm a dermatologist. And you're like, great, that's awesome. But like, like I volunteer at my hometown marathon every year. And several years ago, the physician volunteer who worked in my pod was a dermatologist. And I had no idea. She was super on top of all of her acute care stuff. And by the end, I was like, so does she work in the ICU? And they were like, no, she works at like the dermatology practice. And I was like, damn, she's like really on top of this. So I think, in that vein, we also have to remember, like, we are not dermatologists. Like, stop trying to diagnose these skin conditions, people. Like, they are hard. That's a lot of school that we did not go to.
Mm-hmm.
Anyway, I'll get off my soapbox on that. That's like one of my most favorite ones, but I'll move on. Before I was an athletic trainer, I was an EMT. I worked in the ER. I interacted with a ton of different healthcare professionals, and I learned what people in the emergency medical setting have to bring to the table. And I saw a lot of cooperation in the healthcare team and not a lot of egos. And I think that made a huge impression on me as a young athletic trainer, just looking at the resources you have around you and saying, how can we all work together to get the best possible outcome? I think it's not a knock on you or our profession if somebody enters our workspace and has an expertise that we don't. I'd say it's actually probably worse for us if we don't welcome that expertise and willingness to teach us and support us in the ultimate goal, which is, either in an education setting, obviously getting better, or clinically just providing the best possible care for the patient. Another thing that I've learned over time is being proactive and not reactive. So, if you start working at a high school and you know that your football quarterback's mom is a physician, someone on the soccer team's dad's a nurse, whatever, and they're willing to help, have that proactive conversation and get on the same page before you're out on the field dealing with an emergency and kind of figuring out like, oh gosh, how do we handle this now? Like, oh, cool, they're here, but we never talked about this. Like, just like you run through your emergency action plans and have that meeting with your EMS staff beforehand and all that kind of stuff. Like, if somebody's willing to help, which a lot of people are in sports medicine, this is a pretty volunteer-based field. They're willing to help. They're willing to put their time and their expertise on the line. Like, use it smartly, engage it. I got really annoyed once. I had a kid whose dad was a urologist, and she got hit in the head, and she didn't get knocked unconscious. So obviously not a concussion, right? Yeah. And so she didn't report it, and she kept playing. And then like 5 days later, she felt like crap. And I'm like, oh, gee, I wonder why. And I was kind of annoyed by that. But then like later in the school year, I had a bunch of boys lacrosse players who refused to wear cups, and that didn't end well. And I was like, well, at least I know I have a good urologist in my back pocket.
There you go.
Exactly. Like, I had a kid's mom who was a dentist, and I personally hate teeth. So when she was like, hey, I'm a dentist, if you ever need anything, I was like, that's perfect, because if it gets their tooth knocked out, I don't want to deal with that, but I know you do. So I guess long, convoluted answer, but I think it's recognize your strengths, recognizing where other professionals can complement the areas where you're not the expert, being open-minded, clear in communication, and preferably proactive. Remember that if somebody's getting engaged, it's because they want to help, so let them in.
Speaking along those lines, actually, that's a great segue. What is the etiquette when talking to another profession about learning what their profession is, and how do you advocate to explain what ATs do?
I think the most important thing is to go in with an open mind and educate yourself. Our profession has a lot of specialty areas, some that are emerging. I mean, I don't know anything about the industrial setting. It seems super popular, but I don't know much about that. And I'm an athletic trainer, and so is everybody who does that, right? Ask questions. And I think an important thing is to not just write somebody off as, if you think you know everything about their profession, you probably don't. You also can't assume that you know what experience someone has just because of what they're doing now in the current moment. One time we had a PA come and cover a football game, And I didn't know the guy, but he was super nice. We start talking, and it turns out he was also an athletic trainer. And so, a kid comes over from the other football team and they're like, hey, can you do a spat tape? And I just kind of rolled my eyes. I was like, I don't do spat tapes. And he was like super excited. He's like, no, I'll do it. It's cool. Do you have some tape? And he was just thrilled to get some J&J in his hands after a few years. And I was like, have at it, dude. So I think definitely being open-minded is the most important thing you can do. Try not to come in hot. That's probably the worst thing that you can do. Even if you're all hyped up, the situation's crazy. Just, know that everyone's, again, in it with the best interest of the patient at heart. And we all want to be better. We're all a part of the team. In terms of explaining what an athletic trainer does, I try to stick to the basics and try to stay just calm and reasonable about it. I think a lot of our success comes in what we do and not what we say. So just demonstrate that you're capable, demonstrate that you're competent, and usually it'll come. And sometimes you're just going to meet somebody who's a jerk, and it is what it is. Those people exist everywhere. Sometimes people are just having a bad day. Just let it roll.
As you go through as like an athletic training student, you get so focused on what you want to do and like, oh, well, if I want to be in the pro setting, I have to do everything pro setting wise. How has your previous experience, especially the residency, prepared you for your current setting?
So my residency was really focused on preparing me and my cohort to be successful in the physician practice setting, which is actually where the rest of my cohort and most graduates from my program work. Some work in like surgical device companies, other administrative roles, but I think I only know one who works in the traditional collegiate setting other than myself. My path has been very long and winding. One of my mentors, I kind of joke, I'm like, gosh, what am I doing in my life for a while? And one of my mentors gave me a card with the Tolkien quote that not all who wander are lost. And I was like, wow, you're right. Like, this is really valuable. So I approached it. I mean, obviously I had some reasons for going into different settings, but I wanted to learn as much as I could. And just, I got this mindset probably about, I don't know, probably 4 years into my career. I attended NATA, and that year, a couple of the faculty I was living in Connecticut at the time, and a couple of the faculty from UConn did a lot of talking at NATA, as they do. And I heard these people talk, and I was like, my gosh, these are some amazing researchers in my field. They are teaching an hour away from where I live. Like, what am I doing? Alison, like, go surround yourself with these people. So I did. And that kind of hammered home for me the point of, if you surround yourself with the people that can teach you what you want to learn and help you achieve the goals that you want to achieve, do well and learn from them and continue to push yourself, you can really do some things far beyond what you ever expected. I tell you right now that if 21-year-old me was looking at my resume, they'd be like, no, stop. This is like not, you didn't do all of this. Really? Why didn't you just stay in one place? But I think, in terms of how that's prepared me, I mean, yeah, I don't suture very often anymore. I haven't sutured since I left working in the physician practice setting, but my imaging interpretation skills, not nearly as good as they were. Because I just don't use them there very often, but the kind of advanced evaluation skills that I learned there, I use pretty regularly. Working in an orthopedic clinic, you'd feel 30 positive Lockman tests a week on some rotations, right? Getting these surgeons to teach you kind of their nuanced way that they've developed over 25, 30 years of practice exclusively working on one joint, and they take the time to teach you, like that really hones your skills. Nice. Being able to be in the OR and do a pivot shift test on like dozens of anesthetized knees, like that's how you learn how to do it. Doing a bunch of load and shift on shoulders, things like that. It's just that super high volume of evaluations. And that repetition was really helpful in getting those skills from where most people are to like, hey, I actually feel like I have a pretty good handle on this. I worked with a surgeon who specialized in osteochondral lesions of the talus. I saw them once a week for 2 years. That's not something I honestly know if I'll ever see again in my collegiate career. I never saw one. I actually looked at him one day and I was like, hey, so I worked for 7 years before I came here and I never saw one of these, or 6 years, whatever. And now I've seen like 15. And I'm just wondering, like, have I been missing something? He's like, well, no, I kind of attract them. He's like, they're really not that common, but they get missed. I'm like, oh, okay, that's good to know. One of the other things that I think has been incredibly helpful is the network that I've developed. So as I said, I have friends who, most of my friends and the rest of my alumni network still work in that setting. So I can reach out to my athletic trainer friends who work for these surgeons to discuss these really tricky cases. I just did it last week, especially with the less common stuff. You know, we have time on our side. We often spend hours with a patient working through an injury before they even have a chance to see a doctor, let alone if we held off on the evaluation or the referral. So, you know, I can kind of get an idea of what's going on. And I think the other thing is cool is that if I want to rule out a zebra, you know, they always say if you hear hoofbeats, think horses, right? But like zebras happen. Having seen a lot of zebras, because I worked with a bunch of surgeons who saw a lot of weird and uncommon stuff, and being able to clearly articulate why I think that this unexpected thing that probably shouldn't be going on actually might be going on, or should at least be ruled out, it makes it a little bit more seamless. So it's been definitely helpful. Not the most common route, but definitely a helpful one.
Yeah, residencies are really getting more popular. And I think that, I mean, a lot of people think that if you go to a residency, then boom, I'm going to be working in the physician practice setting. But as we see with you, it's awesome that you're able to take some of these ideas and concepts and evaluation skills that you learned and really bring it into the collegiate setting.
Yeah, for sure. And when I was working in that setting, like my rehab skills were like shot. I just wasn't using them, right?
Mm-hmm.
In this setting, like I'm not using some of the skills that I developed there. I've got them in my back pocket. They'll be rusty. If I needed to use them again, I could. I also think I've been very fortunate because when COVID happened, I realized that I had a plan B. You know, given my experience, like I have experience in almost every setting of athletic training, with the exception of industrial, which sounds awesome. So I knew that if something were to happen with my job, that I at least had a backup plan and I could probably be a really good candidate for a physician practice job because of that experience. So it at least prepared me for something down the road. You know, my husband and I, we're starting a family, and I know that if the Division I setting gets to be too much, which I really hope it doesn't because I love it, you know, I have a backup with a pseudo 9 to 5. I should say that physician practice jobs, at least the ones I'm familiar with, are not 9 to 5. That is misleading at best.
Being in the collegiate setting, in particular D1, like you said, and having a spouse that is also a medical professional can make work-life balance tough. How do you maintain that work-life balance?
Yeah, so that's a great question. I think I am probably not alone in saying that I'm completely obsessed with my career. I don't know any athletic trainers who do it because of our super awesome pay and our really, really cushy hours and all this widespread professional respect we have. You know, my husband, he's an ortho PA. He's dedicated to what he does. He really is. But his approach to his job is not the labor of love that mine is, and is probably not what most people listening to this podcast feel like their relationship with their job is. We started dating before either of us was in our careers. We were even friends before that. So we have a strong foundation that does not involve going to work. With that said, we're both pretty career oriented and our careers overlap. So we bounce stuff off each other all the time. Both of our careers have evolved. When he first finished PA school, he worked in the ER, and then he started working for a hand and trauma surgeon. Now he works mostly with two surgeons who do sports medicine, some total joint stuff. He's my go-to when I'm looking for some foundational knowledge on something that I'm interested in, but may not be like totally in our scope of practice, like antibiotic choice, medication interactions, a lot of gen med stuff. I never use him as a substitute for my team physician. It's not appropriate on so many levels. But sometimes I kind of use him as a filter to reassure me, like, I think I'm going to refer this. I don't think I need to refer this, right? And and he kind of, you know, supports me in that. And a lot of times he'll go into, you know, like a detailed answer, which is really nice because I feel like it just kind of helps my foundational knowledge a lot. When he first got into ortho, and especially when he was working in the ER, he had a lot of ortho questions for me. I remember like teaching him the carpal bones, which is so funny because then he went and worked for a hand surgeon and he can school me on anything hand and wrist now. But you know, a lot of times what he asked me about now has evolved to like rehab questions, because you know, even through his expertise in orthopedics now that he's developed through work, he you know, that's just not something they do. So he's like, hey, I've got this patient, they're not getting better with PT, what do you think? And I can bounce him some ideas like, well, are they doing this in PT, are they doing that in PT? So that kind of helps his practice too, I think. We both work like 40 to 60 hours a week. We are both super happy in our jobs that are unfortunately about an hour's drive in opposite directions. And so, yeah, work is definitely a big part of what we do. We try not to let it dominate. I give him a lot of credit. He does a way better job of leaving at work than I do. So that forces me to at least be better at triaging things as they go. You know, if a kid calls me on a Sunday afternoon with severe abdominal pain and doesn't know what they should do, like, yeah, he's like, totally fine, deal with it. But if I'm like, I'm going to write some rehab programs, he's like, can you not? Can we like go do something fun? And I think that that's good for me. And I honestly think that that influence helps me avoid burnout. I think that we are naturally a group of incredibly dedicated professionals, probably to a fault. And it's a good thing to be reminded to take a step back when it's appropriate.
You guys sound just like us.
Yeah, I was going to say.
Who's the take a step backer?
She is.
Am I?
I feel like you are, yes. Because if I was just hanging out by myself at home, I would probably be reading.
Oh, he'd be reading. He does it all the time.
Yeah. Well, as a podcast listener, I appreciate that because your reading is very useful.
Oh, I'm glad. Thank you.
Yeah.
Yeah, and we even had hour drives in opposite directions.
Yep, that's right.
You do what you got to do because it's worth it sometimes.
Yeah.
Yeah, really. I mean, especially like we always joke all the time that we're both I'm super competitive, so
Yeah,
luckily he's a few more years certified than I am. I think if we were this like on the same, and we're like completely different clinicians, I think if we were like a little bit closer in like anywhere in the same like playing field level, I think that we would not like do so well. But bouncing ideas off each other all the time is really what we do when we get home. And I think that's the funny thing is when we were like, oh, hey, what's your work-life balance? And the first thing you said was, hey, so we go home and we bounce ideas off each other. And it's like, oh, yep, back to that medical. Well, yep, that sounds like work-life balance.
Well, I think it's important what you said, too, is that we do have different clinical philosophies, which is good for both of us because she keeps things in perspective for me because, you know, I've worked in the D1 setting too, so I've worked one sport for such a long time.
And I've bounced around a ton, kind of like you, Alison.
So it's helped me get a game plan on like what's another way of thinking instead of what I've had the past few years.
Absolutely. That's awesome. I'm so glad that
it's a huge thing.
Yeah, I think it is. Yeah, I mean, work-life balance, I don't know. Do athletic trainers really take a break from work? I don't think so. But as long as you're happy with that balance, I don't think that balance needs to be 50-50. I think it just needs to be a balance that works for you and works for your relationship and what you're trying to do both in and out of work. And if you can find something that is a good balance for you, that doesn't have to be the same balance as somebody else.
Well, not even to mention the people who are listening to this are athletic trainers, and it's an athletic training podcast, so I bet you they're listening to this on their free time.
Yeah, exactly. Whole bunch of nerds we are, but I wouldn't trade this crew for anyone.
Seriously.
So last thing, we always like to tie in our applicable knowledge, and we've kind of had such a broad topic for you today, so instead of just like pinpointing it on what do we want you to like one sentence, really we're trying to ask, what do you want our listeners to apply to their careers after listening to this episode? One action item. I would say respect. If I can just take it down to one thing, have respect for yourself, have respect for your potential and your goals, respect your profession and how you represent it, respect other professionals. I think that that's an incredibly important thing to do that we kind of have hit on a little bit, but
if you want other healthcare professionals to understand the valuable role that an athletic trainer plays in the healthcare team, then I think you owe them the courtesy of learning the valuable role that their profession plays as well. And I think it's really important to respect what you know, but also respect what you don't know. I didn't really talk about that specifically, but this is probably like the number one thing that I preach to students is the most important thing that you can learn about yourself is exactly what you don't know. I think it's just way more valuable. It's important to respect the process, respect the system, respect your patients. Just take a step back and look at the big picture. If you approach everything with an open mind and respect, I think you're going to get better results in the end. You'll also be a lot happier because you won't be angry all the time.
That's true.
We like that. So originally Alison was going to come on just to talk about her experience within the healthcare team, which we kind of took that and ran with it and kind of brought in as many other topics as we could just to try to just pick her brain.
Definitely. I know for me, as we were talking to her, I learned a lot about the residency, and I wanted to talk about that because I don't think a lot of athletic trainers know about that route and the benefits that can come from that.
And you don't have to do it right after you get out of school.
Exactly.
Also, I love that we touched upon work-life balance as well. That's a huge thing.
Oh, big time, especially with both of them being healthcare professionals. Kind of like us.
Kind of like us. So anyway, guys, if you're new, we actually do every other episode as education or stories. So this was one of our education episodes. So next week, we're actually going to be sharing stories from other athletic trainers, and we're actually focusing on emergency situations.
Now, we got a pretty good response with that one, too.
We got a really good response. So we're going to be sharing anything from responding to strokes, C-spines, spleen lacerations.
You should have seen Sandra. She was on her phone all day the day she posted for stories, and she was acquiring quite the plethora of stories.
So if you guys want to contribute to some of our future story episodes, you totally can. We have upcoming stories as first time as a certified, so anything that was really memorable to you, something really cool or something that was something that you didn't expect when you were first certified. Another episode we're doing is favorite gifts or ways you've been thanked as an AT, because this is a pretty thankless profession. I think we can agree.
And I've had a unique gift before. I can't wait to share that one.
Oh, I can't wait for that. Most rewarding return to play. We're going to be sharing some of your stories, and then also AT resolutions for the new year. This is like any goals that you have for your career. So if you want to submit any of your stories, you can go ahead and email them to atcorners@gmail.com. And we also put the upcoming stories in our Instagram stories. So if you follow us on Instagram, AT Corner Podcast, then you can also get a head start and look at what we're looking for there.
Nice.
And then also we have a Facebook group. It's an AT Corner community. We always post episode threads. So if you want to comment on this episode or really any episode that we've had so far, or if you want to share a case study, or if you want to share a funny story or something that you just think other athletic trainers would like to hear, maybe an article or two, just head over to our AT Corner community at facebook.com/group/AT Corner Podcast, and you can join the conversation.
And then if you're also listening on Apple Podcasts, please do not forget to share, rate, and review us. We love to hear your guys' comments, and it gets us giddy when we see some nice things.
And we'll share some of your reviews on the show.
So please don't forget to click, hopefully, those 5 stars and leave a review.
Do you have anything else to say, Randy?
Nope, that was perfect. Thank you for helping us showcase athletic training behind the tape. Bye.